So Ryan just shared where Cority is headed, and I want to take a step back and talk about why this moment really matters for this community. Over the past 20 years that I've worked in EHS, I've asked plenty of you a simple question. Why did you choose this work? And for many of you, it was personal. The answer was often a father, a brother, a daughter, or a community. Something that went wrong that caused harm and lasting consequence and it left an impression on you. For others, it wasn't one event. You're problem solvers. You may have started in IT or operations or consulting, but you were drawn to solving problems that matter, to making a difference. But no matter how you got here, for nearly all of us, at some point, this stopped being just a job and it became a responsibility you chose to carry. And that matters because the impact of this work and the impact of work as a whole can be devastating, and we have the ability to prevent that. And it rarely affects one person. It affects families and communities and sometimes generations. In my own family, my grandfather died when he was my age from a lung disease that he got working in the mines. My dad lost his father when he was 6, not too long actually after this picture was taken. And that had a huge impact on the trajectory of our entire family, something that my children feel even today. And I share that as a reminder of what we all know. And that is that when there's an issue at work, it rarely impacts just one person, and it rarely stays at work. It goes far beyond the fence line. And sometimes our responsibility shows up not just in prevention, but in response. You just saw the video of Bryn talking about the devastating wildfire that impacted Smithfield. The employees were deeply affected. There was no data and no dashboard that could have prevented it. But in that moment, they looked to the EHS team, and the EHS team stepped forward. Not because they had better data, but they looked to them because of their leadership and because they were trusted. They stabilized operations, they supported people, they helped define what came next. And Bryn said, I want every location to trust that we're going to do our best to make things better. And they do trust her. And that's the weight of this work. It's prevention when we can and leadership when we must. This community is often unrecognized and underappreciated. Your work doesn't always make headlines, but it does change outcomes. Right now, because of the people in this room, there's somebody safe at home with their family that wouldn't be otherwise. There are illnesses that have been prevented and communities that were protected. And at Cority, we see that and we appreciate it, and we're really grateful to be a part of this community that makes such a difference and carries that responsibility. So I do just want to take a moment and thank all of you for the work that you do every day. We also see that this work has gotten harder. The scope of what you're responsible for has grown, and the pace of work is faster. Experience is retiring and walking out the door. New risks are emerging, and expectations are rising. And layered on top of that, you have more data coming at you than ever before. And while data does represent progress, it also raises new questions. What can you trust? What's signal and what's noise? What deserves your attention? And when more data is visible, there's also more to be accountable for. Just having more data does not automatically create clarity. Sometimes it actually increases the burden and creates inefficiency. And in EHS, inefficiency can be a very big deal. So let me give you an example. Parkland Health is a community-based health system serving one of the most vulnerable populations in Dallas region. The staff at Parkland Health are improving health outcomes, one patient encounter at a time. And Charisse White-Goodman and her occupational health team at Parkland are responsible for ensuring that the staff can stay healthy so they can continue to take care of that community. And she said something that really stuck with me. The real cost of inefficiency isn't measured in paperwork. It's measured in the patients who don't get seen. And when it comes to EHS, inefficiency isn't just administration. It isn't just a headache. That can mean real meaningful impact where you're not able to spend the time where you want. Now, Charisse and her team are doing an amazing job. Through their tools and processes and programs they've put in place, they've seen a 25% improvement in return to work timelines and a 15% reduction in lost time. That means more patients in that vulnerable population are being seen. They show us that our work is having impact, even as the information around us becomes more complex. Of course, we all know there's more work for each of us to do. Serious injuries and illnesses are still happening. Environmental releases are still occurring. And looking forward, what's clear is to have a bigger impact, we have to look at the problem from a different angle. For years, we've organized risks into programs. Safety here, environmental here, health in one place, quality somewhere else, hopefully still in the room. That structure has helped us build discipline and to make meaningful progress. But over the last decade, our understanding of risk has evolved. Through research, through experience, through approaches like Safety 2 and human and organizational performance, we've come to see work differently. Because the risks you're managing don't stay in their lane. The person doing work doesn't experience risk in programs. They experience fatigue and heat and stress, like me right now, distraction, pressure, and that context drives behavior. The latest research shows us that we have to consider not only the effect of the work on the person, but the effect of the person on the work that they're doing. When workload rises, decision quality declines. When fatigue and pressure increase, so does risk. But at the same time, people are the most resilient and adaptable part of the system, and we need to make sure we're enabling them, not working against them. And it isn't only the people that interact, the programs do too. A maintenance delay can become a safety issue. A quality deviation becomes an environmental release. Even standards have moved in that direction. So ISO management system frameworks explicitly designed to integrate safety, environment, and quality. Because real operations don't separate them the way that our binders once did. It's all connected. The world you work in is messy and layered and dynamic. And now, more than any time in history, we have the data, the understanding, the methods, and the tools to see risks and how those risks influence one another. And when you can finally see the full picture, you manage it differently. That's exactly what happened when Hannah and Nikki at the occupational health team at Christus Health created a program to address workplace violence. To start, they needed all the information, but it was all over the place. HR had complaints, nursing had notes, occupational health had injury reports, risk had a system, security had a system. It was 5 departments, 5 different systems. When they brought it all together into the single source of truth, their first reaction was shock. 894 workplace violence events in 1 year. And this wasn't things suddenly getting worse. This is the way it had been for a while, and they just hadn't been able to see it. But once they could see it, things changed. They took action. They identified gaps they didn't know existed. They built education where it was missing. And they changed what happens after someone reports an event. Where before they might not have heard anything, now they ensure every report triggers follow-up. Someone gets a call, support, care. And during one of those calls, an ER nurse who had been hit said, "Wow, I didn't realize that you all really cared." And that says everything about the shift that was underway and is underway that the team is creating in that culture. When they could see it clearly, they could respond differently. And that's the shift. It reflects something bigger. With the tools, data, and methods that are available to us now, for the first time, we can surface patterns across sites in minutes instead of months. We can see risk building and notify supervisors before something goes wrong. We can put relevant guidance in the front of our frontline workers at the moment that it matters. We now have new tools that allow us to connect and act on them. So when something does happen, we can respond faster And that extends all of your impact. It means you can intervene earlier, respond better, and focus your effort where it will change what happens next. The responsibility hasn't changed. What has changed is our ability to meet it. And this isn't something just happening in this room. Organizations everywhere are asking the same questions. How do we move from reacting to events to preventing them? How do we extend capacity without overwhelming or burning out our teams? How do we focus attention where it will actually have the next best impact? Those questions are being asked by professionals, by teams, carrying out the same responsibility that you do. And that's why we're here this week, to learn from one another, to share what's working, and to define the path forward. Because the opportunity in front of us isn't just to keep pace, it's to extend your reach and the impact of the work you do every day. We did some research on this, and Eric is going to walk through what the broader market data shows. Really, where they really sit today, and what separates the leaders from everyone else. So, no matter where you are today, you can see the path forward and the next step you can take. And together we have the opportunity to extend the impact of the work you do every day, because you chose this work for a reason. Because a daughter, a father, a community deserve better.